Hi everyone, this is Dr. Romik Vadhvana. I'm presenting this video very first time. The reason for this video is I'm launching one platform. It's a Dentavibe, and the Dentavibe involves three things. One is it's a teledentistry platform. So during this lockdown, I'm getting a lot of calls, and most of the calls are WhatsApp calls, Facebook Messenger. So I thought let's share this knowledge with everyone. Okay, so I'm launching this free teledentistry virtual consultation platform. So let me introduce you to the Dentavibe portal. You can use this as a teledentistry platform, as I said earlier. You can also use it if you need any second opinion about your dental needs. And lastly, if you want to educate yourself to prevent any future problems, because most of the conditions, they are silent and it may not give you pain initially until it reaches to the final stage. So, due to the current situation, it's very difficult for the people to reach out to the dentist because most of the clinics, they are closed now. However, we are opening up gradually with some new protocol. So, in this presentation, I'll be sharing how others are using teledentistry so that if you or your loved ones have any questions or concerns, you can reach out to me in a similar way. With the help of this presentation, you can get the advice even before visiting the dentist. During this COVID-19 pandemic, I'm following the recommendations of Royal College of Dental Surgeons of Ontario, and we have started with providing all the dental treatment with the new protocols, considering the safety of the patient. So yes, we are open now. So there are situations such as when there is a bleeding from the mouth that doesn't stop, or unbearable tooth pain, or a swelling around the mouth area, or gum infection which gives you pain, or if you have any broken tooth filling or a denture, or if you have a crown or a bridge which came out, and any kind of jaw trauma. So for all of this condition, teledentistry will play a major role because you don't have to wait until you visit the dental clinic, but instead, you can expect some sort of guidance immediately before even you visit the dentist. So please note that this virtual consultation by no means substitute any dental examination. So in certain cases, medication may not be appropriate and an actual dental examination may be required to come up with a definitive diagnosis and the treatment planning. So let's look at this, how this teledentistry is different than telemedicine. This will be an easy and light-hearted video call where you will be in control and I'll be there online, face to face to help you. But that's not enough. Along with the phone call or a video call, there will be a lot of sending text messages, pictures of your mouth as well, so that I can assess the situation properly. Let's have a look at the example, how one of my patients had sent me his mouth pictures via WhatsApp. And this is when his bridge came out while eating the brownie. Very sad. I may need some more pictures from a different angle so that I can do the assessment properly. And those pictures might look disgusting to some of you, but that's what I need to be able to help you properly. So once I had all the data, I did the analysis and explained him why visiting a dentist immediately is necessary in his case. If he would have waited for longer, then the bridge would have become non-functional and he might have to get the new bridge done, which would have cost him a lot. So in this case, with the help of those many pictures, I could figure out 5 other different issues apart from his chief complaint, which is the bridge came out. So when I say take some pictures and send it to me, it may not sound good to you, but that's what I need to be able to help you properly. After the consultation, he went to the dentist near to his location immediately, and he sent me this message. As he was living in a North Ontario, so it was difficult for him to come to my clinic, but that's okay. He got the advice when he needed, without being a distance as a barrier. I also sent him a video link about how to do a proper flossing. And I also shared him a video about how to take care of the bridge. That was his reaction before and after his virtual consultation, and that's the advantage of teledentistry. Get the most appropriate advice at the time when you need it badly. Let me share another case. So his crown came off after eating an apple, and he sent me this picture via WhatsApp. But that wasn't enough for me to reach to the conclusion, so I requested some more pictures from a different angle. and I got these pictures, his front of the face and the crown which came off. I got some more picture from a different angle, but now I could do the analysis properly and reach to the conclusion. Then I explained the patient via video conference why this is very crucial. So you can see my face in the middle of the picture, and after my explanation he was relaxed and booked his appointment immediately. So that's the advantage of teledentistry. Let me share the last case here. So patient booked a virtual consultation appointment, and after the discussion I told him to share some more pictures, and he sent me this. And I know that was my reaction. And I also requested him to send me the picture from a different angle, and he tried his best, which is enough for me to reach to the conclusion. And I think one of the picture might be your reaction, right? Then I explained how his current situation is affecting his oral health via high quality video, and also shared some recent research statistics about how such kind of condition affects his overall health, such as the heart and the brain. I also shared him some high quality video links. So, if you want to know how you are doing in terms of maintaining your oral health, then feel free to book your free virtual consultation. And if you are watching this presentation on your laptop, then I would request you to pause the presentation, scan the code via your mobile phone, and if you are watching it in your phone, then please click the link in the description. So, when you will book your consultation, you will see a very short form. Just fill those details and you will get an email with all the information. So to summarize, first step is to book your free consultation, and after a quick call, you can send me all the pictures. Just try your best in this step. And finally, get the consultation with the high quality videos so that you can understand what's really going on in your mouth and why this is important for your future health. And in case if I think I need to prescribe some medication, then don't worry, we'll make a call to your pharmacy and prescribe you all the medication. But we're going to send you some forms about your medical history so that we don't give you the wrong medication. And if you feel something like this, then don't worry. I'll be sharing a lot of tips and professional advice in the future, so you can follow my Facebook page to get the regular updates. Finally, I want you all to be safe and be ready for the new normal. And during this COVID-19 pandemic, safety of our patients and our community is our priority. We are offering this service of virtual triaging to limit our patients' exposure, keep them safe at home, and reduce the burden on emergency clinics and hospitals. The purpose of this consultation will be to provide advice and the medication to manage the dental emergencies. If the issue still does not resolve, then an inpatient appointment may be booked. So, when you visit, we all agree that there will be a new normal. A lot of technologies will integrate into all the sector. That includes dentistry as well. So, I want to go through what you might expect when you will visit the dental clinic. You might see a lot of infection control measures and a longer appointment time as well, just to protect you and our staff members. Now your car will be the waiting area, and definitely by this way, we can promote the social distancing. As fever is one of the major symptoms of coronavirus infection, you might expect a temperature screening before you enter into the clinic. You may have to wear a mask most of the time, and if you don't have it, don't worry, we will give you one. And obviously, our favorite, that's a physical distancing. So we will try our best to provide a physical distancing, except the time when I'll be performing a procedure. And last but not the least, you have to fill a COVID screening questionnaire form before you even visit the clinic. So by this way, we can triage the patient accordingly, whom we should allow and whom we should send it directly to the hospital. With this, I would like to thank you everyone for watching this presentation and looking forward to seeing you for the online virtual consult. Goodbye.